I was born and raised in Detroit. I love my city. I adore all the growth and the architecture and all the amazing things we've accomplished, whether it be Motown or the automotive industry. And as I've traveled the world and spent time and lived in different places, I find that there's no place like home. Detroit will always be home to me, and it'll always be a place that I love. I love this staple, which is amazing. And it really inspired me to do my podcast called Detroit Girl Transformed. I decided to do this podcast on Resilient Radio, which is a Black-owned station based in Detroit. And it really highlights the transformation of my city while I, as an individual, was transforming. And what kind of people come out of Detroit, which are really people with hustle and grit, who are determined and also exhibit perseverance. The podcast will really focus on different people that have different phases of transformation, whether it be their finances, their well-being, their travel experiences, how they transform their relationships, how they transform their spiritual beliefs. Because at the end of the day, we all want the same thing, and that's what's best for our city, and that's what's best for our legacy and our future and our family. Happy Women's History Month. I'm so excited about today's discussion with these dynamic women in the healthcare industry. What a great time to talk about African American women's health and our well-being. Now let me introduce our amazing panelists. First, I'll start with Dr. Rosalind Miller. Dr. Miller is a board-certified obstetrician and gynecologist for almost 20 years. She's a member of several national committees to include maternal health. Rosalind is CEO of Health Matters Solutions and a proud advocate of women's maternal and primary health. I'm excited to chat with Dr. Miller today on some preventative healthcare goals and plans that we can look at in the future for Black women's health in the industry. Next is Kimberly Stokes. Kimberly is an experienced healthcare executive with a proven track record of 15 plus years of driving sustainable growth and profitability across several healthcare organizations. Kim is a licensed and registered occupational therapist who leads with empathy, compassion, and a holistic approach to recovery following a life event. I'm looking forward to chatting with Kim today about well-being and the healthcare administration aspect of patient care. Last but not least, Dr. Katrina Hughes. Dr. Hughes specializes in pediatric radiology and is also a clinical assistant professor at McGovern Medical School. Katrina is a proud graduate of Howard University of Medicine. She's a passionate patient advocate and also really focuses on empowerment, which will be a great contribution to this organization and this discussion. All of these women represent Delta Sigma Theta Sorority Incorporated and Alpha Kappa Alpha Sorority Incorporated in the Divine Nine. So let's give a warm welcome to our panelists and let's begin this robust discussion.
Hi, I'm Katrina Hughes. I'm based in a little bit close to Houston, Texas. I studied internal medicine and pediatrics initially. I went out and practiced as a hospitalist for several years, and then I went back to do radiology as a residency. I finished a fellowship in pediatric radiology, which I've worked in the last 10 plus years. And I'm very excited to be here. I'm very passionate about brown people in healthcare. I think representation matters daily, and I am very, very passionate about us having a voice in our own healthcare. Thank you for having me.
Thank you. Thank you for joining us.
And I'm Dr. Rosalind Miller, board certified OBGYN. I've been practicing obstetrics and gynecology for probably almost 20 years now. So women's health has always been a passion. I do it every single day. And more so, women's health, but also women's education and just making sure that we are always armed with research-based information and not just what you see a lot of times on social media platforms, but just making sure we know what's real, how to advocate for ourselves, how to optimize our health, wellness, and just happy to be here.
Welcome.
Thanks.
All right. Hi, everyone. I'm Kimberly Stokes. I'm actually an occupational therapist by background. This is my 20th year as an OT, but I've moved into the healthcare executive spectrum. I work with finance and insurance. And so my job is to educate patients and family members on their plans, their policies, but also I oversee the inpatient rehab division of our hospital. So I ensure that they get the physical, occupational, speech therapy, and neuropsych that's necessary so that they can reintegrate into the community. My passion is wellness because I did a overseas study just to do Eastern medicine versus Western medicine. And I really believe that if we work on the front end, we'll have less to clean up on the back end. But as a therapist, we love to like take it day by day and help you figure out how you can reintegrate into the life that you know. So thank you for having me.
Thank you for joining. And I think it's just a really good time to have this conversation. We're just starting out Women's History Month, which is a really exciting time for us to celebrate some of the great things we've done as women. So I love the girl power on the call today. I think it's pretty dope to have so many women on the call talking about some amazing things. So when we think about Black women specifically, it's just so many statistics that are focused on our well-being and our health. One being that we're almost 60% more likely to have hypertension or high blood pressure, 3 times more likely to possibly die at childbirth, according to some recent statistics from the CDC. And so I wanted to just spend a little bit of time, a two-part, one on how do we continue to advocate for ourselves from a well-being and a healthcare perspective, but also as the patient or advocate for patients that are family members in the second half of the conversation. What are some good tools and recommendations on how to be a patient advocate? I think that both are very important. I think many times we're really leading and supporting our family and really advocating for the community, just some of the things that we've seen over the years. So the more education and empowerment on how to transform that experience, the better. So are we ready to get to it?
Ready?
Ready. All right. So first question. I wanted to just kind of start with Dr. Miller and Dr. Hughes and just talk about what resources or advice would you give to anyone regarding being heart healthy?
Well, February was Heart Health Month. And so we did, a lot of education on that respect. And I think the biggest thing is one, you have to know what the risk factors are. Some things you can control, some things you cannot. For example, family history. We can't do a whole lot with family history. But in terms of other risk factors, high blood pressure, for sure. There's ways that we can modify our blood pressure outside of just, taking your medication that's prescribed, but things like simple things like a heart healthy diet, avoiding a lot of sugars, your processed foods, your sodium, things of that nature, making sure you're getting an adequate amount of exercise. We say at least 150 minutes of kind of moderate exercise a week, which is really about 30 minutes, 5 times, a week. Or if you're doing more vigorous exercise, 75 minutes a week should be good. But just making sure that you're staying active and keeping that heart, which is a muscle, keeping it active as well. So diet, exercise. And I think one of the biggest issues for us is stress. So trying to find ways, and I know we'll talk about this a lot, to minimize stress. It's a huge issue, especially for Black women, because we carry the weight of a lot on our shoulders, and that's family, that's work, that's taking care of aging parents, that's kids. There's a lot that we carry, jobs, working our way up in different corporations and whatnot. So stress, we know, is a heart, has negative impact on the heart. It increases certain things like your cortisol levels, which can affect your blood vessels to the heart. So maintaining your stress levels. So those are just a few of the ways that, you can kind of help with your heart health.
And I 100% agree with everything she said. My only thing I would add too is just the screening test and starting early. I think we think of heart health as being something as an older person. I still feel very young, although my numbers are not that. And we wait till we feel bad or we have a bad incident before we think about our heart. I think we should start from day one. We should start with our children, with exercise and diet, and even stress reduction. I mean, I'm raising teen girls currently, and their level of stress sometimes amazes me. Like, they are under quite a bit of stress just trying to fit it, be people in this world right now, and they are living a very different world than even some of us grew up in. So I think starting early and thinking about heart health from day one, as opposed to after the event or in our 60s or 70s or later down the line. I think we should be thinking about it, at every stage. And we are seeing younger and younger people affected with some of these things. So I do think this, having an annual checkup, checking your cholesterol, just the small things, even as you're quote in your 20s and 30s, that's time to start. And so some of those things can be modified to prevent you from having some of the larger events down the line. So everything Dr. Miller said, I 100% agree, but I just think we should start early.
Mm-hmm.
That's a good point, because I do think you start thinking about those screenings at a different age, and it would be good to be proactive on it so that you can kind of get some of the long-term effects. You can be preventative of that when you get in a different age group. I like to call it seasoned and not
Mm-hmm.
older. So it'd be good to be proactive. And so just kind of, I think, Dr. Miller, you talked a little bit about the stress, and I think we'll touch on that quite a bit. And that is actually something that's specific to Black women. I found it interesting. I found in February 2024, the CDC led a campaign called Live to the Beat, which was kind of issuing a call to action to Black women on self-care and well-being. And so I love to hear from Kim and Dr. Miller on what are some things that you think we should do, and what are some things that we could do regarding well-being, and why is it important?
Okay, well, thank you for this question. In terms of well-being, like a lot of times people don't identify hobbies that they enjoy. And I think that time blocking is critical for people to incorporate things that actually are considered leisure. So often we just work our way. We think that work is a badge of honor, but rest and recovery is also just like an eminent part of health that people don't take into consideration. So, as a treating therapist, one of the things we do is we have people write 5 things they're looking forward to getting back to when they go home, and then set an actual date to that so that they can accomplish those type of goals instead of focusing so much on all of the work that they left that piled up. It's just like, well, let's schedule some fun and actually execute it. So I think just making fun a part of your normal routine will help to let you live to the beat.
I love that. Live to the beat. And I'm thinking about trying to have a dance break every hour in my workday. It hasn't worked yet, but at least maybe once a day have a dance break. I don't know if I want to stand up on a Zoom and do the dance, but I was thinking about trying to incorporate a dance break into my time block.
I think you'll make yourself laugh, and that'd be fun.
Yeah, I totally think that's a great idea. I like, just the idea of time blocking and just making things a priority. We just tend to forget ourselves when we're in the process of doing everything else. So prioritizing yourself for sure, and recognizing that is such a big part of your health. It's more than just, like I said, coming to doctors and whatnot. I mean, we appreciate it for sure, but making time for yourself is such a huge priority, and it's necessary. I mean, we know we don't have much to give if we're not pouring into ourselves. So I think Kim is spot on with that time blocking for sure.
And I think that sometimes we view making time for ourselves or prioritizing ourselves as another task, but all the other tasks will kind of get wiped out if you're not showing up as your best self. And I think one of the things I learned is I can't go to the spa every day. I'd love to, but I can't. So, how do I find that 5 minute of meditation or just something like that, where it's a part of my daily routine and not an actual event where I'm going on vacation or going somewhere, but just incorporating it into just even, some micro tasks throughout the day. So I think that it would be good to just get some best practices from each of you, starting with Dr. Hughes. Like, what is in your self-care toolbox? If we took a peek at your toolbox, what would we find?
This is something I've really been working on. I am definitely a chronic giver, busy with lots of things. So things that I've been working on is I have a daily practice of meditation and prayer that I start my day with. I try to start my day with exercise, and I don't let anybody speak to me for the first hour I'm awake. I try really hard because what happens is they come with their needs and you jump to it, and so you get out of your routine. So that's my time blocking that I'm working on. I also think that having partners in it who just to support you as women who also value what you do, that encourage you. You have the friends who say, girl, you're not doing anything for yourself. When was the last time you did something for yourself? Like the people who kind of keep you accountable. Sometimes that's therapists, sometimes it's your mom, sometimes it's your other friends, but it's people to support you in kind of quieting that voice in your head that makes you feel a little guilty for taking the time to yourself or getting wrapped up. So I that has been helpful too, to have friends who we are kind of on this journey of, hey, we need to do this together more. And I think it's really great if you have a group of friends who you can share that with. Sometimes it's just a happy hour, like, man, I had a terrible day at work, or it's been a ridiculous week. Can we get together, and having a group of people to call on who are like, yes, I got hey, girl, I got 30 minutes for you. Let's go. That kind of thing. So those are my big ones. And I think having family and friends and people to help support you in trying to make those changes has really been helpful.
All right. Kim?
So my outlet, well, I love accountability partners. And honestly, if I didn't have a financial investment in something, I was going to push it to the side. So I signed up for Pilates, and I make sure I make every single class because it costs me. But I love the reformer. It relaxes me. It helps me feel youthful, but also it helps you kind of get to the core of things. And then it's like relaxing. So I have a very strict morning routine, which I do. I have to have that alone time as well, just to start my day and keep my mind clear. Because the minute I'm around people, she's absolutely right. Dr. Hughes is they need something from you. And being a solution giver, I always have an answer. And so I love the fact that starting the day, like with my devotion and prayer, and then vitamins and routine, just to set myself up to have an energetic day, and then ending with the exercise of Pilates helps me sleep really well at night. So that's what I do.
I love it.
Very good. Very good. So I have to plan, and I don't want to say plan, but I really have to kind of Sunday night or Sundays are my days to kind of get the week together in my head. A lot of times that may just be, what we're eating for dinner Monday, Tuesday, Wednesday, or whatnot. But I like to look ahead. I like to make sure I know what's on my calendar, what's on the schedule. So I'm just not free falling all over the place. So that's my Sundays. Like that's my laundry, my, kind of getting my scrubs all washed up. Like that's my day to get things taken care of for the most part. And I agree. I used to try to work out in the evening, but in OB, babies come in very random times. So it's too unpredictable. And I wish I could sign up for a class, but inevitably that will be when I'm called into the hospital. So for me, it's mornings. Like, again, I have to get up before my family wakes up because that is literally the only time that I can get on that Peloton that I'm paying for still. My husband reminds me, but that is the time that I can do that.
We should follow each other.
We should do something because I need some motivation. If I hang up one more article of clothing on it, we probably have a problem in my house. So, but that's the time that I can kind of get myself together, have some water, cup of coffee first, just before the world wakes up. So that's my kind of 5 a.m. thing that I do. My office hat, they know, do not, when I first walk in, do not meet me at the door with a Dr. Mulligan. No, I need a minute. Like I need a minute. So you really have to train the people in your home and the people at your workplace what you need. And if my door is closed, that means give me a minute. So setting those standards for everybody around me so that I'm a much more pleasant person to deal with.
Give me a beat, right?
Right. Give me a second. Give me a minute.
I
And
definitely. Oh,
I'm
go
sorry.
ahead.
I'll have to say that too. Like sometimes it's also putting up barriers. Like my mom gets up with Jesus. Like she gets up so early, and she is all about the 4 a.m., 5 a.m. phone call. And it took a while for me to just kind of say, "Hey, mom, I love you, and I promise I'm going to call you, but I cannot answer the phone for. I need this block of time." And it was almost it was a source of stress. So I think it is very important to just let people understand and have a conversation of, hey, you can call and you can leave a message, but I will not be looking at that, answering that until X time. And
Mhm,
I think that's
mhm,
really, really important. Just
mhm, mhm.
Yeah, the way my schedule's set up, it's just better for me to work out in the morning, and I have a 8 o'clock reminder with affirmations, and then I have sometimes I share Bible plans. I share Bible plans with Kim. We haven't done one in a while, but it's just really that alone time, because sometimes you'll just hit the ground running and the day will get behind you, and you want to definitely ground yourself into the day. And I've actually done a bit of an experiment and kind of journaled my days on days that I didn't work out or do an affirmation and a Bible plan. And those work conflicts were a little bit more intense than other days. So I do think you have to ground yourself a little bit just to deal with what's ahead of you. And for me, I try to go have a habit. I'm going to get back into the habit of doing yoga stretches at night just so I can sleep better. Because I do like to do the Peloton in the morning, but you can get really stiff on the bike if
Mhm,
you don't do some good stretches before and
mhm,
after. So I try to do some stretches
mhm.
at night. These are the things I'm trying to do, but I want to go back and get
Yes. And
back
those
into.
stretch those stretches are going to be even more important as we kind of keep moving into this perimenopause stage of our lives.
Mhm.
Like, and Kim is doing the best with that Pilates. I mean, as we age, that balance becomes an issue. Arthritis, the hips, the ligaments, and all that. So Pilates is amazing. Our stretches, amazing. Strength training, all those things that we know that we need to kind of keep geared up for, because it comes a lot faster than you think. A lot faster, a lot faster.
And the things that used to work for you when you were in your 20s and 30s, they don't work in the 40s anymore. So I
Nope.
know that you have to change that exercise plan with aging. Otherwise, it's going to be ineffective.
Right.
So we
100%.
have to evolve it.
100%. I remember losing 10 pounds for a party on Friday. Like like, oh, I got this outfit. Like I literally remember, I'm gonna try to lose about 5, 6 pounds for Friday. That was like for Christmas. Like it's just, it is not giving.
It's not
It's
hitting the
not the
same.
same.
And I think we talked about this a little bit earlier. I just want to touch it, as we kind of wrap up the portion of the discussion on Black women's health. We talked a little bit earlier about, and I think this is a well-known CDC about, how Black women are 3 times more likely to have pregnancy complications and die, whether it be from preeclampsia, and I think it's just good to give some advice or suggestions to future Black moms or just future moms on some things that they can do from a preventative perspective or just some things to watch out for.
Yeah. So patients come to me, and that is oftentimes, during our initial conversation. And this could be either if they're thinking about getting pregnant or if they are currently pregnant, but it inevitably comes up like, Dr. Miller, I don't want to die. And I don't, that is not, no, that's it. But it's truly a fear. And, unfortunately, our numbers do look like an underdeveloped country numbers in terms of the morbidity and mortality for Black women in this country. So we're looking at why is that, and so even when you make everything equal in terms of access to care and making sure, insurance and whatnot, we still have, higher rates of preterm labor, higher rates of postpartum hemorrhage, higher rates of even mental health, postpartum depression, anxiety issues. All those things tend to increase for us. So certain things I definitely tell my patients who are thinking about conceiving and trying to conceive is you have to optimize your health as much as you can beforehand, right? So there's some things that I need to make sure I'm paying attention to as an OB, but there's a lot of things that we need to do to optimize as best as we can. So if I have a patient with chronic illnesses who has, let's just say, hypertension, and they're planning to get pregnant, optimize your blood pressure as much as you can. Make sure that you're telling your primary care physician or even me that you're planning to get pregnant so that we can make sure you're on the right medications. There's certain medications for blood pressure that you cannot take when you're pregnant. So we need to make sure that your blood pressures are well controlled, you're on the proper medications. Same thing for diabetes. If you come diabetic, we got to make sure those hemoglobin A1C numbers are good. I always send my patients who have chronic hypertension or diabetes to cardiology, preferably before they get pregnant, because we know that in pregnancy, you have a higher risk of cardiovascular issues as well. So optimizing your health beforehand is always going to be the best way to go. And then, preeclampsia is one of those things. Sometimes you can, I won't say control it or prevent it, but if you have high blood pressure, that increases your risk. If you are above the age of 35, that increases your risk. If you are Black, that increases your risk. If you have a BMI greater than 30, that increases your risk. So a lot of things increases your risk of developing preeclampsia, which is a kind of a placenta issue in pregnancy that you can get. So that's where your obstetrician has to have a high sense of awareness and what to look for. So for me, I tell patients, women have been having babies for centuries. My job is to make sure that you don't develop preeclampsia and hemorrhage, so those are the things that I am looking out for. I am putting you on certain things that have been shown to decrease your risk. We are looking at your blood pressure. I'm making sure you have a cuff at home. We are talking about, headaches, blurred vision, like looking at your urine, make sure you're not spilling protein. So I'm very diligent about making a look at little subtle changes that can occur with women as they go through their pregnancy. A lot of times preeclampsia doesn't pop up until that third trimester, and it's like, I was doing good, and all of a sudden, boom. So having that high sense of awareness and what to look for in your high-risk patients, I think as an obstetrician, that's really what my job is. So, I wish there were more of us. I have patients who literally come to me because I'm a Black female physician. We are still unicorns. We make up about 1% to 3% of the population. But wow. I do have some amazing partners, who are not Black, but they are just as, aware. And it may be because I'm nudging, but they're just as aware. So really knowing what to ask ahead of time is important. Optimizing your own health is important. Making sure that you do preconception counseling. So I have patients who come to me, okay, we're thinking about getting pregnant. What do I need to be looking out for? So those appointments are super crucial and important because you can kind of hit a lot of things, even when you talk about depression, because that is also when you look at, morbidity, not so much mortality, but, morbidity in Black women, depression and anxiety. If you have a history of depression and anxiety prior to your pregnancy, you have an increased risk of having it during your pregnancy and even afterwards. And it's not just until the 6 weeks. We're talking about a whole full 12 months sometimes. So making sure that you are plugged in with your counselor, with your therapist, with your preacher, I don't care, but making sure you are plugged in with those people who you need to support you and who can help you. That was a mouthful.
I just want to add another point to this too. It's not just maternal health either. I do maternal fetal medicine. I do fetal imaging, and it so impacts your fetus. And I think sometimes people are willing to do things for their child they're not willing to do for themselves, which is why I do pediatrics and not internal medicine anymore. Women should really think about every step in that pregnancy is not just about them. So you may want that soda, or you may want to ignore or not bother with your blood pressure. But I think if you're thinking about that baby, it really has a strong impact on preterm delivery, respiratory distress. There's a really some interesting work being done about maternal depression and its effect on the long-term health of children and infants. I just think women really need to kind of also reframe it, because we always are worried about that baby, to think taking care of yourself, even from the preconception all the way through that pregnancy, has a long-term impact on your child's health. There's some studies about obesity and maternal depression. So what you are like every day of that pregnancy truly affects that child. And so sometimes we need a little extra push to do it. I mean, we kind of neglect ourselves and won't do it for ourselves, but we should really be thinking of it as two people absolutely being developed here throughout the process.
And I never even thought about it that way. So thank you for sharing that. I think that to your point, if we knew that information, we probably would be even more intentional about how we take care of ourselves during our pregnancy. And so as we kind of conclude just the Black women's health portion of it, Dr. Miller, I think Dr. Hughes touched on this earlier as well, but would love to know any additional important screening tests we should be taking as women, and what age should we have those tests?
Yeah. I see patients really early. When you talk about, I'm seeing, 13, 14-year-olds, and a lot of it is just their menstrual cycles and things like that. And sometimes it's just having that conversation, because some moms are like, when should she stop seeing the pediatrician and when should she start seeing you? And that's really a personal judgment. I think if they're uncomfortable talking about certain things with their pediatrician, then it's fine to come see me. But a lot of pediatricians are great all the way up until age 18, either way, but it's a personal decision. But we like to touch on, from my younger patients, we're talking about menstrual health. We're talking about just hygiene. We're talking about what's, normal, what's abnormal, just getting them comfortable with some of the terminology. Definitely at age 21, that's when you want to have your pap smear, your cervical cancer screening. If your pap smears have been normal, you can stretch those out a little bit, maybe not go every year. And then, definitely making sure you're plugged into your primary care physician, so you can start having those screenings like Dr. Hughes talked about, looking at your cholesterol, looking at your A1C, checking out your blood pressure, things of that nature. And at age 40, you want to start doing your screening mammogram, depending on your history, your family history. First degree relative, you may be able to get that screening mammogram a little earlier. There's some insurance that will cover a baseline mammogram at age 35. But by age 40, that's when you want to start doing your mammograms every year. I'm still an advocate for self-breast exams. It goes plus or minus, whether or not they advocate or say we should do self-breast exams. But I'm like, they're yours. Make sure you know what they're supposed to feel like. So self-breast exams for sure. And it could be you doing them, your partner doing them. Makes me no difference. Whoever can feel a lump, like whoever can notice a lump. So mammograms at age 40, then you start looking at colon cancer screening. It used to be age 50, but now we're looking at age 45, getting your colonoscopies. If you're not real cool on that, you can do a Cologuard, but making sure you're doing some colon cancer screening. Colon cancer rates, I'm sure Dr. Hughes can tell you, is ridiculously high in this country as well. Our diet is horrible. And I can't even blame it just on our diet. I feel like we all need to learn how to garden, because there's a lot of things that go on in our foods that we are none the wiser. So making sure you're getting your colon cancer screening for sure. So those are just some of the things that you need to do. Osteoporosis screening, of course, as you hit that age 65, and all of those sorts of things as well.
That keeps us busy.
Yes, but it's fun. I mean, take somebody with you to your mammogram. It's fun. Me and my girlfriend, we did it. It was on a Saturday morning. We went and got our mammograms done. We went and had brunch, because that is also self-care. So we got our mammograms, we had brunch, and it was fantastic. I highly recommend it.
With me this week. It's funny that you say that. I went last week and I had someone go with me, and then we went to dinner. Take a buddy. Awesome. Well, I think it's just good to have these conversations. And I know it's not the most comfortable conversation, but I think the more informed you are, I think the more you can be proactive about some of the things that you don't necessarily want to be in your path. So, wow, time flies when you're having fun. So many gems are being dropped today. Now it's time for us to take a commercial break and highlight our sponsors that are also great champions of transformation. If you would like to be a sponsor for this podcast, be sure to reach out to me, your host, Toni Carter, at dgt313podcast@gmail.com. Again, that's dgt313podcast@gmail.com. I am excited about the sponsors, and I hope that you have enjoyed the podcast so far. Now it's time for a commercial break. It's transformation time, baby.
I like shiny things. You like shiny things. Got us in trouble. We like shiny things. Thought it would change our world. We like shiny things.
Welcome back from the commercial break. I'm excited to get back to this discussion today. It's transformation time. I wanted to also spend the second half of the conversation talking about something that I think everyone could relate to, and that is how do we advocate for our loved ones, for ourselves from a patient advocacy standpoint. I spent a couple years in biotech, and so I'm very passionate about this specific subject, especially understanding that, a lot of the clinical pharmaceutical drugs that are developed does affect people of color. And so even though African Americans are less than 6% more likely to be in that workforce of biotech, we are 3 times more likely to possibly be the patient just because of some of the underlying health conditions that we have. And so I think, when you are in the medical setting, you don't always know what questions to ask, especially when you're not feeling well or you're unwell yourself, or if your loved one is unwell. So I wanted to spend a little bit of time on how do we navigate some of those conversations and some tips on how to do that with the healthcare system. So I'll start with Dr. Hughes and Dr. Miller. And just, one of the things that happens when someone's unwell is that you or your loved one, you go to the hospital or urgent care. And so I, in some conversations with Dr. Hughes a couple of days ago, I didn't realize there was a difference, but I think there might be a difference based on what's going on with you. So, Dr. Hughes, if you could start us off with just your recommendations on when you should go to the hospital when you're not feeling well, or your loved one, or when you should go to.
And I'll let Kim talk about this because she's on the administrative and money side of this too. So she kind of understands there's a big money difference. So I think it's very important that everyone understand what their coverage is, right? So do you have to go through your PCP for a referral for a specialist, or do you have a PPO where you can just refer yourself? You have to know that because it will absolutely make a difference in how you can access healthcare for yourself and your family. Also, you need to know is what the difference in charges are. For some people's in policy, an urgent care is a no copay or a very low copay if you go to their urgent care. But many urgent cares bill as if they're a standalone ER. And that means you pay, sometimes you have a 60% shared coverage with a large deductible in order to walk in the door. And you go, well, I went to the urgent care. I didn't show up at the ER, but that's not how that place bills. And so I think patients get a lot of surprises with that. They also will show up at an urgent care with an issue such as a heart attack, a stroke, or a major health issue that requires them to be transferred. They'll be transferred by ambulance and pay a gigantic ambulance cost that they are not aware of, or that, God forbid, they have to be helicoptered somewhere. I think that a lot of times we see it all over Houston. I have loved ones in Houston who I have no idea why they stop at urgent cares when they have literally one of the world's greatest healthcare systems at their disposal, and they still go to urgent care with heart attacks, obvious stroke symptoms, and they know it's a stroke. I think I'm having a stroke, but I went to the urgent care. I think patients really need to just have a moment, and they need people in their family to kind of help talk them through that. So the way I think of it, maybe it's a little simplistic, and I'll let other people kind of clean it up if it's too simplistic. But I think that if you feel like you're going to need to spend the night in the hospital, you should go to the hospital. You shouldn't stop at urgent care. If you feel like this could be something bad, in the back of your head, you think, I'm going to need surgery, I'm going to need a specialist, or I feel like this is something's just not right, it's going to need a workup, I wouldn't stop at an urgent care. To me, an urgent care is someplace I go if I think I have the flu and I want to test. I cut myself and I think I need 1 or 2 stitches. Something very minor. Something you would go to the doctor for normally, except your doctor's closed. That's to me what an urgent care is. I see an urgent care as like an extension of my PCP. Anything else beyond that really probably should go to an emergency room. If you feel like it has to be handled right now, I'm scared about what's going to happen here, I think I need a workup, that should go. That said, I see a lot of people also use urgent cares instead of a PCP. they go over and over and over again. I've had a headache, and every time I get this headache, I go to the urgent care. Okay, well, urgent care is okay for the first time if you think it's minor, but then you need to go to a doctor and figure out what's the root cause. Urgent cares are not there to work you up. It's a short-term fix. Even in emergency rooms are not really there to work up your chronic problem. I've had this problem for 2 years and I'm showing up in the emergency room. I think it leads to patient dissatisfaction and sometimes mistreatment just because the setting is made for acute problems. It's not made to work up why you've had this problem or to control your high blood pressure over the long term. There's the assumption when you walk in that you have a PCP and they're going to pick up the baton on this. So we just have to be careful not to fall into the patterns of just going repeatedly to an urgent care or repeatedly to these kind of lesser facilities when we really need our primary care doctor to work up something over the long term, or we need emergency care, true emergency care. I don't know, I'll let other people. I think it's both a cost thing and really life-saving. You could be wasting time, brain cells in a stroke, heart muscle in a heart attack, going to these some of these places.
And just for clarification, PCP is primary care physician.
I'm so sorry. Yes, your primary care physician or your family medicine doc or even
Yes.
your OB. I see women who should be going to the OB or going to the GYN and they keep coming to the urgent care for that.
Mhm.
Also, I think it's important to know in every setting who's seeing you. Um, I'm There are different levels of qualification, and I'm not saying no anyone is unqualified. I'm saying that if you need an extensive workup, sometimes you really need an MD. I mean that, or a DO. And the difference, I don't think patients know. I know that my parents, for a while, were kind of caught in this cycle. I think there are a lot of extenders of healthcare which are very useful. They're nurse practitioners, they're physician assistants, and all of these people are very good, but they're not your doctor. And there is a difference. And I mean that with all respect to those people, but your physician went to undergrad for 4 years and studied a lot of chemistry and biology. Then that person took a very extensive test and got into medical school. I went to Howard Med. We spent a lot of hours at Howard Med studying. We took a year of physiology, a year of anatomy. We took 2 years of intensive clinical courses. And then I said, hey, I want to sign up and go on further. And then I spent 4 more years learning internal medicine and pediatrics and taking a board exam. If I am some of those other things, maybe I spent a year training or 18 months training. So there's a big difference between, 12 years of training and 18 months. And I think in certain settings, great. That's okay for you. But if you need an extensive workup or you've seen an extended, a provider who's an extender and it's not working out and you can't quite get to the bottom, it's okay to advocate and say, hey, is it okay if I see the doc? Hey, I don't quite, because a lot of them work on algorithms, which is great if you fit the algorithm. But if you have something unusual or doesn't quite fit in, or a treatment isn't working, sometimes you need to kind of ask as a collective, hey, can we bring another way, somebody else in to think about this? Can we think about this in another way? And I don't mean it as an adversarial thing because it's always a partnership. And I know that as Black women, we often struggle with this kind of concept that we're angry or we're mad or we're just being difficult. So I often start those conversations with, hey, we're a team and I want us to work together to see how we can get the best outcome for my child, my parent, my whatever. I'm not trying to ask you what to do. It just seems like we tried this and it didn't work, or this is not the outcome I thought. What else can we do? Or is there something more we should be thinking about? It's kind of the way I phrase it. But I think it's okay if something has worked or you don't just feel great to ask questions. It's perfectly okay to ask questions about yourself, your loved one, but to ask it knowing that you're part of a team is kind of the approach I try to take.
Anything else to add, Dr. Miller or Kim?
I totally agree. I think that, I like when I have a patient in my office, I always do the tell me what I told you. That way I make sure that they walk away and they understand what we're saying and what I've asked them to do and why. I think that's very important. A lot of times it's, non-compliance doesn't just come from because I don't want to, but it's really because I wasn't quite sure why where I was expected to do this or what it is that you were actually asking me to do. So I'm a real big component on tell me what I told you so that we can talk it through. And I also love when patients bring a loved one with them. A lot of times there's, you only hear a little bit of what the healthcare provider is telling you, and the rest of the stuff is kind of a blur. So bring someone with you. And if you can't bring someone with you, I have zero problem. And I don't even know if it's a HIPAA violation, but I have zero problem with a woman saying, hey, can I call my daughter? She kind of wants to listen in on this. Zero problem with that at all. I think it helps to strengthen the trust, the fact that we are a team, the fact that I'm taking care of your mom, and I want to make sure that your mom is well.
And the one thing I love that Dr. Hughes brought up is knowing your setting because it has a financial implication on you. So if you go to urgent care and then have to be transported, ambulances can cost up to $1,500 for a one-way trip. And so a lot of people don't know that the cost of having to emergently transition. So we always, in my setting, talk about level of care and what is most appropriate. So even if you've been hospitalized and you're thinking about where should I go next, you want to go to the place that's going to allow you to get as stable as soon as possible within your healthcare network. And if you don't know anything about your network, on the back of everyone's insurance card, there's a phone number for you to call so you can get basic information about what are the benefits, what does this cover, how much am I responsible for, because it's up to you as the person who's covered to know your benefits. And everyone's not going to know it extensively, but you should at least know basic, like what is the cost of urgent care versus ER? What is the cost of going to inpatient rehab versus a skilled nursing facility or outpatient? It's just like, do you even have those benefits in your coverage if you would need those services? So I think just it's a question of should you go, but you shouldn't base it on can I afford it or not, but what is going to help me get everything I need right away instead of delayed.
I have one other thing with that too. I notice at places like Houston where there's lots of hospitals and lots of healthcare, I feel like where you started is probably where you should follow up. I say this, I'm giving a story of my parents. My parents, we talk all the time, so they're okay me giving them as a history. My dad will go to his thoracic surgeon, and his thoracic surgeon will run a test, or find something. My dad will then follow up with his PCP or his nephrologist and ask some question about what the thoracic surgeon did, which is okay, but it sounds simple. And I know when you have a lot of doctors and a lot of healthcare going on, that we tend to just feel like, well, all doctors got it and they all got an electronic medical record and they're all in it. But it's important for someone to be responsible for the thing. So if someone is following I see it a lot with cancer, someone's following your kidney cancer, someone needs to know it's your responsibility and I'm coming to you to follow it up. Now, they may tell you to go to someone else for it, but there needs to be someone who's kind of the primary lead in charge of that, particularly when you have a complex health team. You have lots of people coming and going and lots of people kind of specialists and all that. Once that happens for yourself or your loved one, you kind of need to know who's quarterbacking the whole thing. And if you're getting conflicting information, how do you resolve that? Who's the person in charge? So it's okay to ask questions of like, hey, is this your thing? Like, are you going to follow my heart? Or are you going to follow my cancer? Are you going to follow my, you said you saw this cyst on my ovary. Are you going to follow that? That's okay. So you know who to go back to. In the same way, I see people will go to a hospital, get discharged from that hospital, have a new issue, and go to a brand new hospital. which is okay if you didn't like your healthcare for some reason, but it's not the safest for you to go start all over someplace else. Like, try to have some continuity with your providers and your healthcare, which I think sounds simple, but I think in the rush of things, patients sometimes just kind of go willy-nilly. And we see
Yeah.
this a ton in Houston.
Yeah.
Yeah.
We have a lot of health systems. There's a lot of health systems, and I think patients think we all talk to each other.
Yeah.
And it's not always the case. There's some things I can kind of look and see, but there's a lot of things that I cannot. So I totally agree. And I love it when people just show up and they've gotten their OB care somewhere else, but they're here to have their baby. And it's like, happens all the time because they like this hospital, so they'll come and have their baby there. But it's like, again, we're happy to take care of anybody, but it's just safer to go where everybody knows your name, like Cheers.
Like Cheers. I love that. So for the sake of time, we're going to have one more question. I do think, we started off earlier in the day saying what was in your toolbox for prioritizing your self-care. I'd love to hear from each of you. What's in your patient advocacy toolbox, whether it be for you, your loved ones, your children? What do you have in there? What tips do you have in your toolbox for us as we are out advocating for ourselves and the people we love? And we'll start with Kim.
All right. Well, this is a great question. I have to be an advocate for my mom because she really doesn't know the system or how to navigate the system. But the one thing that I always tell her is if you've earned a benefit and it is a standalone benefit without it being managed by outsiders, keep it that way. As people age, a lot of times they get influenced by the TV ads and like 25-cent savings. And I said, your health is worth more than the 25-cent savings. So keep your traditional coverage, because guess what? No one else gets to dictate whether you you need that service or not. So my patient advocacy thing is take the original benefit as it is, because you're going to get more out of it.
Awesome. I love that. Dr. Hughes?
I have two. I think that every patient should sign up for the electronic medical record patient access. You are your best historian. I remember as a hospitalist, literally 12 times a day, I'd walk in and the patient would go, well, why are you asking me that? It's in my chart. And the way I would always phrase it back to them is, do you really trust us who have 1,000 patients to take care of to know everything there is about you more than you trust yourself to know about you? So I feel like there's so many electronic medical records. As soon as you go in, you can they give you instructions on how to sign up, their apps on your phone, their websites, and you can see everything from your test results. Some systems allow you to see the notes we write as physicians, which has its own problems, but you can have complete access to your medical records. And often those lab results are ready in 24 hours. You are so much more informed and ready to go in a setting when you have information at your hands. I think a lot of times it needs to be discussed, because sometimes a 0.1 difference in a lab is not important. But I think having the ability to see it for yourself and your loved ones, you can appoint other people to have access if you have a spouse or a child or someone involved in your health care. In that same way, I think that every person should have a conversation every adult needs to have a conversation with their loved ones of what they want for their life should something happen. That needs to be around Christmas, Thanksgiving, just where you say what I'm grateful for. That conversation needs to be had. And I think we shy away from it because we feel like you're putting bad things in the atmosphere or bad things in the air. But so sad, so often from children on up, we can't predict what's happening tomorrow. And I think it takes the burden off your loved ones if they know what you want, because it's not, sister made this decision about mom. It's mom made this decision for herself of what she wanted. As soon as you get admitted to the hospital, you have the ability to do that. There are forms you can fill out online and print off that says, I I want to be intubated. I want to be fed through a G tube. I want to be resuscitated. And those are things that you're not too young to have written down and have a healthcare person in charge of your healthcare if you're unable to make decisions for yourself. So those are my two big things that I think we overlook, and we wait till it's kind of a bad, or it's too late, or we don't have the ability to say so for ourselves.
Thank you. That was very helpful. Dr. Miller?
I think the biggest thing that's in my patient advocacy toolbox, and it may just be due to our current climate in this country, is that no one's coming to save you. No one is coming to save you. So you have to be armed with information. And, I have a love-hate relationship with TikTok. Patients come to me, their treatment plans already in place, but I'm okay with it because it at least allows us to have the conversation. Okay, what do we know? Yep, that part's correct. That part's not. That part's almost correct. So I'm okay with patients coming with things written down. Dr. Miller, I read this. Dr. Miller, I saw this. Does this supplement work? Should I be taking these? So I'm okay with all of it because, again, it is allowing us to have the conversation. But the biggest thing is that you have to arm yourself with knowledge. And if you don't know, please seek out answers. And those answers, hopefully come from your physician. But there's so many sister circles, and some of those answers are coming from your friends. We're all going through the same things. I think a lot of us are in the same circles where we're pretty much the same age. So everybody's going through the same thing. So just making sure that you are there to advocate for yourself, and no one is coming to save us. You have to take care of yourself.
I never thought about it that way, but I think that's a good way to think about it and really advocate for yourself, but also do a little bit of research. Because I am the patient that comes in with the information, and my doctor's like, well, that's a great introduction. 70% of that is untrue. However,
it's a good place to start. It's a good place to start.
We can build from that. We can build from that. So I appreciate, being a part
and
of it.
And I'm okay.
Yeah. I feel like it's a team effort, but one person has the MD.
Right, that's okay.
Yes.
TikTok MD.
Right. I'll be like, I got this off of Mayo Clinic.
Yes. And they'll bring in bags of literally supplements to them. I'm like, why are you buying all that? Just eat a salad. Like literally what you're supplementing. Like it should literally be a supplement. Get most of that from your diet. Get mostly all of that from your foods. Am I correct? Like you shouldn't have a bag of supplements for me.
Well, I can tell you that we could probably have this conversation for hours at a time. It was so fun spending time with all three of you. Such great information that I could take back, not just as a Black woman, but as a daughter, as a person that has been supporting my mother through her healthcare journey. I think even some of the conversations around maternal health and also how it impacts our newborn babies have been very helpful. The healthcare system, I think is something that's really important to understand how to navigate. So I really felt like today was extremely relatable to a broad audience. So I want to, first of all, thank you all for taking the time to join me on Women's History Month and really talk through some of the things that we want to do from a transformative perspective when it comes to the Black woman's healthcare journey. So thank you all so much. It was so much fun. I wish we had more time. I feel like there should be a part 1 and part 2 because the information is so meaty. So don't shy away if I tap on you for season 2, but I think it's an ongoing, continued conversation. So that's what the transformation experience is about. Thank you all for joining Detroit Girl Transform, and have a wonderful day. Thanks, everybody.
Thank you.
Thank you.
Now, you don't want to miss next week's episode. I'm so excited about talking about food for thought, transforming the plate and palate with Chef L. Simone Scott. This episode is about how to make food choices you can live with and how can we focus on a healthier lifestyle. Join us every Tuesday at 9 p.m. Eastern Standard Time on the Resilient Radio stream for Transformation Tuesdays. It's an exciting time to take this journey. It's transformation time, baby. Are you excited about this journey of transformation? Let's take this journey together. To continue on this journey with us, each episode will have various examples of transformation. Be sure to subscribe to the Resilient Radio Stream on the YouTube channel and turn on your notifications so you can get updates. It's transformation time, baby.